Okay, so picture this, right? You hear the sirens, see the flashing lights.
Yeah, that desperate race against time.
Exactly. And, emergency medical services, they often feel like controlled chaos. Incredible human skill, definitely, but often very reactive, wouldn't you say?
Totally reactive, mostly responding after the crisis hits. It's the nature of it.
Right. But we've been digging into some sources today, haven't we?
We have a really interesting stack looking at how that whole high-stakes reactive environment is starting to, well, change fundamentally.
We're talking about AI and ambulance services, and our mission here, our deep dive, is really to unpack how AI is stepping in. Not just to make things faster, though that's part of it, but to make the whole system, smarter, more predictive.
Exactly, and ultimately better at saving lives. Crucially, before patients even get to the hospital.
Right, that pre-hospital phase.
Yeah, and the sources, they paint this picture of AI augmenting human expertise. So it's not taking over, it's helping.
Augmenting, shifting the approach, maybe.
Yeah, precisely. Shifting from just reacting when the call comes in.
To something more proactive, like orchestrating things based on what might happen.
You got it. Using data, predicting needs, using real-time info to sort of manage the chaos better. Proactive orchestration.
Okay, proactive orchestration. So where does that start? Does it begin right when the 911 call or the equivalent comes in? At the dispatch center?
That's exactly the first point. The dispatch center. Traditionally, dispatchers use their experience, historical data maybe, current calls.
Gut feeling sometimes, I bet.
A lot of gut feeling, yeah.
Yeah.
To figure out where to place ambulances. But it's largely reactive, right? Waiting for the call.
Okay.
But AI introduces something called dispatch optimization or predictive demand.
Predictive demand. So predicting emergencies before they happen, that sounds, well, futuristic.
It does, but it's happening. It's a real game changer. The AI system, it crunches just vast amounts of data.
Like what kind of data?
Oh, historical incident patterns, population density, where people are, and even temporary things like, big public events, concerts, street fairs.
Ah, okay. Things that temporarily change the risk profile of an area.
Exactly. And it uses all that to forecast, essentially, to say, hey, there's a higher likelihood of incident in this specific area at this specific time.
So instead of just having an ambulance sitting at its station, maybe in a generally busy part of town,
Right.
the system might nudge dispatch, suggest moving a unit closer based on these predictions.
That's the idea. Guided by the AI's insights, they can strategically position units closer to these anticipated hotspots.
And the sources show this actually works, not just theory.
Oh, yeah, definitely. There are examples. One they described involved a big outdoor concert in a park.
Okay.
The AI flagged it, looked at the crowd size, the type of event, and predicted a much higher chance of medical incidents right there in the park during the concert.
Makes sense.
So, based on that prediction, dispatch proactively stationed an ambulance much closer to the park than it normally would be.
Did it pay off?
It did. An emergency call did come in from the concert, and because that ambulance was already nearby,
It got there much faster.
by several critical minutes, the source said. Minutes that can make all the difference.
Wow. Are there, broader numbers on this?
Yeah, the sources mentioned some studies suggesting this kind of predictive modeling. It could potentially cut average response times across the board, maybe by 15 to 20%.
15 to 20%, that's huge. When you think about cardiac arrest or stroke, that time saving is everything.
It's absolutely critical. The difference between life and death, potentially, or long-term disability.
Okay, so AI helps get the ambulance there faster, predicting the need. But, like you said, the clock is still ticking once they arrive. What about inside the ambulance on the way to the hospital? How does AI help the paramedics then?
Right, that's the next crucial piece. Patient triage support in transit, often using what they call decision support tools.
Decision support, so helping the paramedics make calls.
Exactly. While they're transporting the patient, AI tools can be analyzing data that's streaming in. Real-time vital signs, maybe ECG readings if they have the equipment, even processing the paramedic's description of symptoms.
So the AI is looking at the patient's data in the ambulance. What kind of insights does it give?
Well, it can process that data really fast, looking for patterns. It might, for instance, identify a high probability of an acute myocardial infarction, a heart attack based on the ECG and the reported symptoms.
Okay, so it flags a potential heart attack. How does that actually change what the paramedic does right then and there?
That's the key. It's about augmenting their judgment. If the AI flags a potential heart attack with high confidence, the paramedic, they might feel more equipped to initiate critical treatments immediately.
Like what?
Like administering aspirin therapy, for example, something that's really time-sensitive for heart attacks. Instead of waiting until they reach the hospital for the definitive diagnosis.
They can start treatment sooner, based on the AI's assessment.
Potentially, yes. And they can also send a much more specific alert ahead to the receiving hospital. High probability AMI incoming, prepare the cath lab.
So it speeds up diagnosis and treatment initiation right there in the ambulance?
That's the goal. Leveraging the AI's speed in processing that complex data allows paramedics to potentially start those life-saving interventions much, much sooner, which, as we know, dramatically improves outcomes.
That is huge. Okay, but what if it's a really complex case? Or maybe the paramedic just needs a second opinion, but they're miles from a specialist. Does AI help bridge that gap?
It absolutely does. And this is another really impactful area, remote diagnosis support tools. Think telemedicine, but supercharged for emergencies.
Telemedicine in the ambulance.
Basically, yeah. Paramedics can use secure mobile devices, maybe tablets linked to platforms, often using AI to help manage the data flow. They can share everything in real time.
Everything.
Vitals, ECG tracings, even stream live video or send photos of, say, an injury or patient presentation. All securely to a specialist who could be anywhere.
So it's like having a specialist virtually looking over the paramedic's shoulder.
In a sense, yes. The specialist reviews the info remotely, asks questions, provides real-time guidance. The sources gave a really powerful example.
Let's hear it.
A paramedic treating a suspected stroke victim, but they were in a remote rural area, miles and miles from a hospital with a neurologist.
Yeah, that's a classic challenge. Time is brain with stroke.
Exactly. So using one of these AI-assisted telemedicine platforms, the paramedic connected instantly with the neurologist at a major stroke center.
Wow, okay.
The neurologist could see the symptoms via video, review the data, guide the paramedic through a quick remote exam, and confirm the stroke diagnosis. Then, crucially, advise the paramedic to administer clot-busting drugs right there, on the spot, in the ambulance.
That completely bypasses the hours it might take to transport the patient just to get that specialist consult.
Precisely. It connects expertise to the patient, wherever they are, eliminates those critical delays, allows treatments like thrombolytics for stroke to be given much, much faster.
And I guess it could also prevent unnecessary transfers sometimes if the specialist can guide treatment remotely.
That's another benefit mentioned. Better resource use. Maybe the patient doesn't need to go to the super specialized center if the issue can be managed with remote guidance initially. Frees up ambulances and hospital beds.
Okay, this is building quite a picture. AI predicts where to be, helps diagnose in transit, connects to specialists. What about the end of the line? Getting the patient to the actual hospital door? Because just going to the closest hospital isn't always best, right?
You're exactly right. That's another huge challenge. You might race to the nearest ER, only to find it's overwhelmed, on diversion, or maybe it doesn't have the specific service that patient desperately needs, like a trauma surgeon or a cardiac cath lab ready to go.
Wasting precious time.
Exactly. So AI steps in here too with something called hospital capacity integration.
Integrating real-time data from hospitals, like bed availability.
Yes, but it's often more sophisticated than just beds. The AI systems can pull in dynamic data from multiple hospitals.
What kind of data?
Things like current ICU bed availability, yes, but also the status of specialized units. Is the stroke unit active? Is the cath lab staffed and available right now? Even staffing levels. And some systems even try to predict near-future capacity based on current admissions and likely discharges.
Wow, okay. So it's a really dynamic picture of hospital resources. How does that help the ambulance crew?
Well, based on what the paramedics report about the patient's condition, is it major trauma, a stroke, a cardiac event? The AI system analyzes that against the real-time hospital capacity data.
And
then it recommends the most appropriate hospital at that specific moment, factoring in both the specialized care needed and the actual availability of those resources.
So instead of just automatically heading to County General because it's closest.
Yeah, right. The AI might say, actually, County General's trauma bay is full, but University Hospital, 5 minutes further away, has a trauma team ready and waiting.
Gotcha. So it routes them intelligently.
Exactly. The sources had an example, thinking about a severe trauma victim. An AI system could have rerouted them past a closer but overloaded ER directly to one slightly further, but with an available trauma surgeon and operating room.
saving potentially life-saving time by avoiding that secondary transfer or delay upon arrival.
Precisely. It's about optimizing that final critical leg of the journey, reducing delays, getting the patient to the definitive care they need faster, and allocating resources across the whole healthcare system more effectively.
Okay, so when you put it all together, predicting the need, optimizing dispatch, assisting paramedics with diagnosis and treatment in the ambulance, connecting them to remote experts, and then guiding them to the right hospital. AI is really weaving through every single step before the patient even hits the ER.
It really is. It's a fundamental shift, like we said. It's not just tweaking the old processes. It's adding this layer of intelligence, of data-driven, proactive decision-making that just wasn't possible before.
Turning that reactive chaos we talked about at the start into something, well, smarter, more connected.
A more orchestrated response.
It sounds incredibly powerful, but, implementing technology like this, especially in something as complex and high stakes as emergency services, there have got to be challenges, right? It can't be easy.
Oh, absolutely not. The sources definitely touch on that.
Yeah.
Building these systems, integrating them, especially, say, in contexts like India that one source mentioned, it's complex. It needs a phased approach.
What kinds of hurdles?
Well, there are big ones. Things like digital literacy, making sure all the staff, paramedics, dispatchers are comfortable using the tech. There's the cost, of course.
Sure.
This isn't cheap technology or infrastructure.
Yeah, I bet.
And then you have really important ethical considerations. Data privacy is huge. Ensuring fairness, avoiding bias in the algorithms, these are critical things to address.
So it's definitely not just a case of plugging it in and letting it run.
Not at all. It's a major transformation that needs careful planning, investment, training, and ongoing ethical oversight. But the potential to improve outcomes when time is absolutely critical, it's just immense.
It really is leveraging technology to, quite literally, save lives when seconds count.
Right. Helping those amazing human professionals make even better, faster decisions in the toughest moments.
It's quite remarkable when you think about it. AI working almost silently in the background of that emergency response.
A really profound application in healthcare.
So what does this mean for you listening? Well, it means that the next time you see an ambulance racing past, there's a growing chance that sophisticated AI is playing a hidden, vital role.
Helping ensure that help gets where it's needed faster, that the paramedics have better information and support, and that the patient is heading to exactly the right facility for their needs.
All potentially happening before they even leave the ambulance. It really shows how data and AI are becoming woven into the fabric of these critical life-saving services.
Definitely. A fascinating evolution.
And it leaves us with something to think about, doesn't it? As these AI systems become more capable, more integrated into these incredibly high-pressure moments where human judgment has always been paramount, how do we strike that balance? How do we ensure that technology enhances but never overshadows the essential human element? The empathy, the intuition, the connection that's always been at the heart of emergency care.